All right, so this one I want you guys to work out just a little bit. Which client is assigned to the newly licensed nurse? So I want you to imagine your first day on the floor, and I want you to think about some of the patient care assignments that you've seen with your nurses, and I want you to consider who would be okay for you to take versus not okay. Now this question serves two purposes. One, I want you to realize that when you're a brand new nurse, it's actually okay to say, I don't think this is an appropriate assignment and I don't feel like I'm ready for this person. And you might get shot down, but it's still okay to say, I'm not sure this is somebody I should take care of today, okay? But for the purposes of the exam, I do want you to be able to figure out who you should take as a new nurse, who you should assign somebody when you're the charge nurse, who you might assign for the practical nurse that's working with your team for the day, who would be appropriate versus not appropriate. So talk amongst yourselves in the couple of groups that you've got here and come up, just ballpark a couple of folks that you've taken care of that you think would or wouldn't be appropriate and why. So who would you assign to a newly licensed nurse versus not? Throw me a person, Whitney.
I would not assign an elderly patient with pneumonia who should probably be in ICU, like on a med-surg floor. I wouldn't assign that patient that's so critical to a new nurse.
What makes them so critical? Because pneumonia is not. What made them critical?
Like lots of oxygen desats.
So an unstable oxygenation.
Unstable oxygenation.
Tachycardic to Kipnick on BiPAP. Very high settings on the BiPAP.
So tachycardic. The BiPAP that we're using is not being effective. So the interventions aren't effective. They're unstable with their oxygenation. So it's pneumonia, which is fine, but it's complex and the patient's not therapeutically moving the correct direction. So they're unstable. So an unstable patient is not appropriate. Ashley?
Don't know.
You don't know?
I feel like I've had reasonable patients. I think maybe the most uncomfortable I felt is whenever we were in psych clinical and we're in a room and they're like, go in the room, but find an exit. Make sure, you don't turn your back to the patient. And you're just like, oh yeah. And they're having, hallucinations currently. And you're just like, okay.
Unstable psych patient.
But those weren't unstable patients. That was an unfamiliar issue. So be sure to differentiate when you look at those kind of questions. What's unfamiliar to you doesn't mean you can't take care of that person, right?
I feel like further orientation would have made me comfortable.
It sure feel that way though.
Yeah, but like just walking into it and being like, okay, so make sure I have an exit, don't turn my back, make sure my hands are like where they can see them. And you're just like sitting there trying to make sure your whole body's positioned correctly the whole time.
So let's think about this in a more medical sense. Let's say you've never taken care of someone with a chest tube and your person today has a chest tube. You're a new grad, is that appropriate or not?
Yes.
Yes, why?
If you get orientation.
Well, you can't always get oriented to all of the things that you're going to do, and you've probably at least been exposed to it. So what are you going to do next?
Look it up.
You look it up. You find your resources on the floor, right? You look it up. You find your experienced nurses to come and walk you through it, kind of make sure that you're doing what you need to do with it. I mean, even as a non-floor nurse, as the instructor on the floor, they have come to get me for things like that. So it's totally appropriate to recognize that somebody else has a skill that you don't, but you should, and this is the time to learn it. So that's actually an appropriate thing. The main point is to recognize what you don't know and have enough sense to look in the right places and ask the right people, right? So that's a really good example. It's appropriate, but there might be something else involved. Who did you come up with?
To not assign or to assign?
Whichever.
To not assign, I had a patient one time who was in cardiac arrest, but they weren't a candidate for to go for a heart cath, and so they were just continuing going into cardiac arrest, the family hadn't made a decision on what they wanted to do. So they were very unstable, but you were also dealing with the family. So as a new nurse, it was kind of like.
So they were unstable with myocardial infarctions, no treatment decisions. So they weren't exactly a person we could fix, but nobody could make a decision to not fix it. That's very complex.
Yeah.
Definitely, that's a different skill set. And I mean, even if the medical interventions are super low key for that person, because I mean, at that point, you're probably doing oxygen and nitro and those kind of things, trying to keep him stable, maybe heparin, something to try to keep the damage at a bare minimum. But at the very least, you need somebody experienced enough to help the family walk through those issues, because that's an all-day conversation for sure. That's a really good example of somebody who, like, they're physiologically unstable, but also you've got really complex family issues that are going to be happening. That's a good one. Did you come up with somebody?
I have like a diabetic, somebody
Okay.
that maybe even unmanaged. We could teach them the proper insulin use, how to check their sugar, things like that.
Okay.
So I think that would be okay.
That would be an appropriate assignment, definitely.
What about a newly diagnosed diabetic?
Is there anything about a new diagnosis that you would not be able to handle as a new grad?
Diabetic ketoacidosis is pretty complex.
If they presented with ketoacidosis, so if they presented in DKA, that is complex versus someone who's just new and needs teaching. You can handle that for sure. But someone who maybe they've only been in the hospital for a day and they have that new DKA, that's not going to be the best thing because they are unstable still. So do you see that all of the examples that we're coming to basically amount to stable versus unstable? Mm-hmm. That's also going to be true when you're trying to make out your assignments for your practical nurses. So for the most part, they can take anyone who is stable and really should not take anyone who is unstable for the same kinds of reasons. They're not trained yet to do all of the things that might need to be done. Now it depends on the setting and it depends on the nurse, clearly. But generally, those kind of situations for delegation are going to come down to stable versus unstable. If you've got a nurse that's floated to your unit, let's say you're a cardiac nurse and you're getting a nurse from pulmonary for the day. Again, you have to look at what their abilities are, and it's still going to be stable versus unstable, right? Because you don't want them to be in an unfamiliar environment and then also have someone that is unstable. That's going to cause delays in care.